Welcome. I thought we could talk a little bit about pain today. Most of my yoga therapy clients have some pain. I would say the vast majority of them, either from an acute injury of some kind, or for most of them, they have some level of chronic or persistent or recurrent pain. And there's a lot of misconceptions about pain. Our understanding of pain has evolved a lot and will continue to evolve as we study how pain works for humans. Some of the misconceptions about pain that people have can sometimes get in the way when you're trying to figure out how to get some pain relief or how to start to feel better. And so I just wanted to share a few pieces of information that might help you to understand your pain better, as well as the pain of other people around you. The first thing you should know about pain is that pain is normal. Now, pain is unpleasant. We don't like having pain. We often want it to go away. And it sometimes indicates that there's a problem in our bodies. That being said, pain itself is normal. It's a sign that our bodies are functioning correctly, and it's there for a really good reason. The second thing to know about pain is that pain is a warning system. So the function of pain is to let us know when there's danger. And in a really obvious example, if you put your hand on a hot stove, you're going to feel pain. And the purpose of that pain is to motivate you to remove your hand from that stove before further damage to your tissue occurs, right? Where it can get a little more murky is that pain as a warning system is designed to try to alert you to all kinds of potential dangers. And the word potential is really important here. They're not actual dangers. They're things that your system thinks might potentially be dangerous. Your warning system casts a very wide net because it doesn't want to miss anything that might hurt you or harm you, right? And so your body will alert you with pain when something is dangerous, like burning yourself or breaking a bone. But it will also alert you with pain in all kinds of situations that are less dangerous or not dangerous at all. Sometimes, indeed, nothing scary is going on. In fact, possibly the majority of cases, nothing scary is going on in your body. But you're getting a warning either to prevent future injury or just in case. And there's all kinds of reasons why that can happen. Okay. The third thing that's really important to know about pain is that pain largely occurs in your brain. So your brain is getting all kinds of information all the time from your tissue via your nerves. And it gets information about temperature, it gets information about pressure, it gets information about tissue being stretched. It gets all kinds of data. And your brain filters this data because if we had to process all of the data that we get from our tissues, we would be dysfunctional, right? We wouldn't be able to do anything. We would just be processing information. We'd be extremely overwhelmed. So your brain has kind of a filtering system to decide which signals are important that we need to pay more attention to. If your brain deems that you need to pay attention to something, you'll start to get more sensation. And the more important it feels or the more urgent it feels, maybe that sensation is going to start to get turned up a bit. Remember, this is not the same as the more dangerous it actually is, right? There is a processing and filtering system going on in your brain itself. Okay? And there's all kinds of ways or reasons why your brain might decide that something is important to pay attention to. Not all of those have to do with some kind of damage going on in your body. In fact, we can see in research that there's very poor correspondence between the amount of tissue damage that's going on down in the body and the amount of pain that you feel. Okay? If we scan a whole bunch of people's low backs and take a look in there, lots and lots of folks will have damage to the tissue in the low back, but absolutely no pain at all. And then there will be folks who have nothing visible on the scan, but they have pain. So the relationship between damaged tissue and pain is not a direct one-to-one correspondence. It really corresponds quite poorly, actually. And that is because that the processing is happening here. It's not happening down in your tissue itself. Okay. A fourth thing you should know about pain is that your pain system is predictive. So your brain tries to guess if something is going to be dangerous and to prevent it. One of the things that happens because our brain is predictive is that if you've had an issue in a part of your body before, say your knee, then you're more likely to feel pain there in the future because your brain gets sensitized to that area. And it says, okay, this knee was a problem before, it might be a problem again. I'm going to open the filter up a little bit and I'm going to alert you a little bit more to anything that's going on in your knee, just in case, because there's past history, we want to prevent future problems, right? And so this is one of the ways that the signals from a part of your body can get turned up and your brain can get really sensitized to what's going on in that area, even though maybe there isn't actually anything dangerous going on, right? The last thing you should know about pain is that pain is about much more than our body. And in a way, I've been talking about that throughout this whole video. But what's important to know, what I'd like to get a little more explicit about here, is that your pain can be affected by all kinds of things outside of your body itself. So your stress level will affect your level of pain. Your emotional state will affect your level of pain. Your relationships with the people around you, your level of confidence, what you eat, how well you sleep, all of these kinds of things will affect your level of pain, potentially. And so there is a whole constellation, a whole landscape related to your pain to navigate. It's not just about what is going on in the cartilage of my knee, but it's also about what is going on in the rest of my body and what is going on in the rest of my life that might potentially be related to how my knee feels. And so you can start to look for these kinds of patterns. Sometimes they matter more for some people than others, but it's really worth taking a look at things outside of just that one body part to see what other things are connected to your level of pain. I hope you found this really helpful. Please feel free to ask questions in the comments. And I hope that this really helps to change how you see your pain and maybe the pain of others as well.